Hiccups for a year. Is that even a real thing? Bo Jackson said he had hiccups for almost a year. This is Dr. David Chao, Sports Injury Central, Pro Football Doc. I'm an orthopedic surgeon. I'm certainly not a hiccups specialist. There's no such thing. But I am a medical doctor, and we dealt with all sorts of things as a head team physician, including hiccups. Would say that we haven't had any player with one over a year. But Bo Jackson, Bo knows a lot of things. The original two-sport athlete, he obviously knows hiccups. I'm here to tell you he's not lying. Hiccups, intractable hiccups, is a real phenomenon. It does happen. In fact, it even has an ICD-10 code. What is that? That's officially recognized by the government and insurance company medical diagnoses. It has its own code, intractable hiccups, something like RO6.6, whatever it is. The bottom line is it is real. So how do you deal with hiccups for a year? Obviously, that's a big, huge deal. First of all, it can last continuously. A lot of us, almost everyone, has had hiccups and they've gone away. Some have lasted longer than a few minutes. We've all tried the different solutions, but it is possible for it to be lingering. It's probably not constant. You're probably not hiccuping 24/7 for a year. If that were the case, how do you even get any sleep if you're hiccuping all night long? So the hiccups can come and go, but it's considered part of the same intractable case that it's there all the time. Bo Jackson's even said he's been golfing. Hard to golf with hiccups. I mean, that 2-foot putt, and you have a hiccup, and I guess you owe somebody money. But in any case, the hiccups are probably not 24/7 and constant. They probably come and go. If they were constant, you probably need medical attention even more quickly. Common cures for hiccups, sure. Scaring someone, boo, drinking water, gag reflex, stimulating your uvula, pulling on your tongue, gargling with water, rubbing your eyes even hurt, a paper bag breathing, eating dry bread or peanut butter, maybe for gag reflex, holding your breath. I have never heard of what Bo said, smelling the ass of a porcupine. Never heard of that. But asking around, maybe it's something that's in the South. I don't know. What does an ass of a porcupine smell like? Is it worse than that of a skunk? Why does not smell a skunk? I don't know. How do you get close enough to a porcupine without getting stuck? Gloves, hold them. Where do you get the porcupine? A lot of unanswered questions, and we'll have to get Bo Jackson on our podcast, medical podcast, to do that. But you can see his frustration. It is very, very real. Usually the hiccups are self-limiting, but in some cases they're not. They're intractable. Then what do? There are some medical treatments, some medications. Look, when there are this many wives' tale cures, that means not a single one works absolutely. When there are multiple medications that can be used, it means they all don't work regularly. If one worked regularly, you just go on that. There's different ones for muscle relaxers like baclofen, or antipsychotics even like haloperidol. Dopamine antagonists, you don't need to define that. Different medications can be used to try and suppress the hiccups. They don't always work. Hiccups happen due to an irritation or hyperexcitability of the diaphragm, the phrenic nerve, and that's where some of these cures where, gag reflex and, maybe the smell is the same way, and dry bread and the water, try to and somehow turn off the stimulation of the phrenic nerve or change it so that you don't have that diaphragm irritation for the uncontrolled hiccups. Sometimes there's a vagus nerve input that's involved. Bo talked about getting a surgical procedure. There are surgical procedures. There are several options. One is injection to numb the phrenic nerve. One is to ablate or burn the phrenic nerve to prevent this overstimulation. Sometimes there's such things as vagus nerve stimulators implanted. Look, I don't know the situation with Bo Jackson. I'm not a hiccup expert. Hopefully there's no one out there. I don't think there's anyone out there that is just a hiccup expert. But this is a real condition. We can laugh at it all we want. No one wants to have intractable hiccups. You can see how irritating it would be in life. Heck, I couldn't be an orthopedic surgeon. I couldn't be a doctor. I couldn't carry on a conversation with someone. Certainly very uncomfortable to continue with hiccups. Hopefully Bo Jackson can get cured, but it is real. He's not making it up. It's a recognized diagnosis with a different paths to a cure, and hopefully, and would expect him to be cured. So hopefully next time you have hiccups, you're not grabbing a porcupine to smell. The traditional tickling your uvula, gag reflex, water, boo, scaring, etc., holding your breath, they typically tend to work. If not, there is help for you from other doctors. This is Dr. David Chao, Sports Injury Central. Thanks for watching. Subscribe here. We try and cover all issues in sports that involve medicine. I do this in consultation with my primary care team sports doctors like Dr. Jerry Ezon, since I am an orthopedist. Thanks for watching.